Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 27, 2025. This video is on two recent New England Journal of Medicine articles. One, an original titled Low Dose Aspirin for PI3K-Altered Localized Colorectal Cancer by the ALASCCA study group. And the second is an accompanying editorial titled An Aspirin a Day for Improved Colorectal Cancer Outcomes. Colorectal cancer recurrence remains high despite curative therapy. Aspirin shows preventive benefit in hereditary colorectal cancer, like Lynch syndrome, and may enhance disease-free survival in colorectal cancer with PI3 kinase pathway mutations. PI3 kinase mutations upregulate COX-2, increase prostaglandin E2, which in turn results in tumor growth. Aspirin may disrupt this axis. The study design, it was a multinational, double-blind, randomized controlled trial in Sweden, Denmark, Norway, and Finland. Stage 1 to 3 colorectal cancer patients with PI3 kinase pathway alterations were enrolled. They were aged between 18 to 80 years. And post-surgical resection. The arms included aspirin 160 mg daily versus placebo for 3 years, 1:1 randomization. Group A included PI3 kinase 3CA exon mutations. In Group B, other PI3 kinase pathway mutations. The sample size, 626 were randomized, 157 per arm in each group. Follow-up imaging at 1 and 3 years with symptom-based evaluation. Statistics, Cox models, Allen-Johansen and Kaplan-Meier methods. No multiplicity correction. What did they find? In Group A, there's a 3-year recurrence. The 3-year recurrence was 7.7% in the aspirin group versus double-digit recurrence, 14.1% recurrence in the placebo group. Hazard ratio 0.49, p-value 0.04. 3-year disease-free survival, 88.5% in the aspirin group versus 81.4%, hazard ratio 0.61. In Group B, the 3-year recurrence was 7.7% in the aspirin group versus 16.8% in the placebo group, hazard ratio 0.42. 3-year disease-free survival, 89.1% in the aspirin group versus 78.7% in the placebo group, hazard ratio 0.51. Adverse events. Severe adverse events in the aspirin group was 16.8% versus 11.6% in the placebo group. Limitations of the study: no power for subgroup or dose duration analysis. Genomic data unavailable for 803 patients. Overrepresentation of rectal cancer in failures of genomic analysis. Key takeaways: aspirin reduced colorectal cancer recurrence in PI3 kinase altered tumors, may be effective targeted adjuvant for about 40% of colorectal cancer patients. Precision oncology at low cost, repurposed, accessible intervention. The accompanying editorial talks about the context and controversy. Aspirin's COX-1, COX-2 inhibition has long been leveraged in thrombosis and colorectal cancer chemoprevention. However, earlier randomized controlled trials, Aspirin and Ascol, showed mixed results in unselected colorectal cancer populations. Why ALASCCA matters? The ALASCCA trial enrolled only patients with PI3 kinase mutations. A biomarker-driven design showed 3-year recurrence reduction in the aspirin group, despite modest rise in adverse events. Practice-changing implications. Early aspirin initiation post-surgery with biomarker selection should result in improved outcomes. The authors argue that this sets a new standard of care. Universal molecular testing with early low-dose aspirin in PI3 kinase mutant colorectal cancers aligns with broader oncology trend. Example, atezolizumab in dMMR colorectal cancer, adjuvant targeted therapy in lung and breast cancers. Key takeaway: Biomarker-driven repurposing of aspirin signals a return to simplicity with surgical precision. Clinical pulse, aspirin benefit linked to PI3 kinase 3CA mutation by inhibiting COX-2 pathway. In Group A, canonical hotspot mutations. In Group B, broader PI3 kinase PTEN alterations. The number needed to treat one recurrence was low, as 6 in stage 3 rectal cancer. Benefit stronger in women. Body weight and gender may modulate response. Adverse effects were manageable. Aspirin was well tolerated. Eponyms and study design highlights. If you hit pause, it discusses Graham-Theranos test for proportional hazard assumption and Aylan-Johnson estimator for cumulative incidence functions. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.